I'm happy to give at your consideration the lecture called The Preventive Program of Epidemic Diseases and Vaccination Plan for Children under 5 years old. Vaccination is the administration of antigenic material, a vaccine, to stimulate an individual's immune system to develop adaptive immunity to a pathogen. Generically, the process of artificial induction in immunity in an effort to protect against infectious disease works by priming the immune system with an immunogen. Stimulating immune responses with an infectious agent is known as immunization. Vaccination is a clinical application of immunization designed to artificially help the body to defend itself. A vaccine against infection is a modified form of a natural immunogen, which may be either by whole pathogen or of its components, or a toxin. A vaccine does not cause disease when administered but induces the healthy host, the vaccinee, to mount a primary response against epitopes of the modified immunogen and to generate large numbers of memory B and T cells. In a vaccinated individual, naive B and T cells capable of combating an infecting pathogen are present in relatively low numbers when the pathogen is first encountered. A primary immune response is all that can be mounted so that, in many cases, the individual becomes sick until antibodies and/or effector T cells can act to clear the attacker. In a vaccinated individual, a collection of circulating antibodies and the expanded army of pathogen-specific memory B and T cells have already been generated prior to a first exposure to the natural pathogen. When the natural pathogen attacks, the circulating antibodies provide a degree of immediate protection from the invader. In addition, the memory B and T cells are quickly activated, and a secondary response is mounted that rapidly clears the infection before it can induce serious illness. This type of vaccination is called prophylactic vaccination because it is intended to prevent disease. What can be used as an antigenic material? Alive bite-weakened microbes, killed or inactivated microbes, purified material, for example proteins of microorganisms, synthetic vaccines. Vaccination includes various ways of administering immunogens. Some vaccines are administered after the patient already has contracted a disease. Vaccines given after exposure to smallpox within the first 3 days are reported to attenuate the disease considerably, and vaccination up to a week after exposure probably offers some protection from disease or may reduce the severity of disease. The first rabies immunization was given by Louis Pasteur to a child after he was bitten by a rabid dog. Since then, it has been found that in days, wound care and treatment of a bite with rabies immune globulin, commenced as soon as possible after exposure, is effective in preventing rabies in humans. Most vaccines are given by hypodermic injection as they are not absorbed reliably through the intestines. Live attenuated polio, some typhoid, and some cholera vaccines are given orally to produce immunity in the bowel. While vaccination provides a lasting effect, it usually takes several weeks to develop, while passive immunity, the transfer of antibodies, has immediate effect. It was Edward Jenner, a doctor in Berkeley in Gloucestershire, who established the procedure by introducing material from a cowpox vesicle on Sarah Nelms, a milkmaid, into the arm of a boy named James Phillips. 2 months later, he inoculated the boy with smallpox, and the disease did not develop. In 1798, Jenner published an inquiry into the causes and effects of the variola vaccine, which coined the term vaccination and created widespread interest. Early attempts at confirmation were confounded by contamination with smallpox, but despite controversy within the medical profession and religious opposition to the use of animal material, by 1801 his report was translated into 6 languages, and over 100,000 people were vaccinated. Vaccination policy refers to the health policy a government adopts in relation to vaccination. Goals of the vaccination policies are the following: immunity and herd immunity, eradication of disease, individual versus group goals. Vaccination policies aim to produce immunity to preventable diseases. Besides individual protection from getting ill, some vaccination policies also aim to provide the community as a whole with herd immunity. Herd immunity refers to the idea that the pathogen will have trouble spreading when a significant part of the population has immunity against it. This protects those unable to get the vaccine due to medical conditions, such as immune disorders. Every year, vaccination prevents between 2 and 3 million deaths across all age groups from diphtheria, tetanus, pertussis, and measles. The impact of immunization policy on vaccine-preventable diseases has been listed as one of the top public health achievements. Malaria clinic in Tanzania, helped by SMS for Life program, which organizes malaria vaccine delivery. With some vaccines, a goal of vaccination policies is to eradicate the disease, make it disappear from Earth altogether. The World Health Organization coordinated the effort to eradicate smallpox globally through vaccination. The last naturally occurring case of smallpox was in Somalia in 1977. Endemic measles, mumps, and rubella have been eliminated through vaccination in Finland. The World Health Organization has targeted polio for eradication by the year of 2018. Rational individuals will attempt to minimize the risk of illness and will seek vaccination for themselves and their children if they perceive a higher threat of disease and a low risk to vaccination. However, if a vaccination program successfully reduces the disease threat, it may reduce the perceived risk of disease enough so that an individual's optimal strategy is to encourage everyone but their family to be vaccinated, or, more generally, to refuse vaccination at coverage levels below those optimal for the community. Governments often allow exemptions to mandatory vaccinations for religious or philosophical reasons, but decreased rates of vaccination may cause loss of herd immunity, substantially increasing risks even to vaccinated individuals. However, mandatory vaccination raises ethical issues regarding parental rights and informed consent. To eliminate the risk of disease outbreaks, at various times governments and other institutions establish policies requiring vaccination. A few other countries also follow this practice. Compulsory vaccination greatly reduces infection rates for associated diseases. Common objections included government intervention in personal matters, or that proposed vaccinations were not sufficiently safe. Many modern vaccination policies allow exemptions for people with compromised immune system, allergies to vaccination components, or strongly held objections. Vaccination is unique among de facto mandatory requirements in the modern era, requiring individuals to accept the injections of a medicine or medicinal agent into their bodies, and it has provoked a spirited opposition. This opposition began with the first vaccination, has not ceased, and probably never will. From this realization arises a difficult issue: How should the mainstream medical authorities approach the anti-vaccination movement? A passive reaction could be construed as endangering the health of society, whereas a heavy-handed approach can threaten the values of the individual liberty and freedom of expression that we cherish. A vaccination schedule is a series of vaccinations, including the timing of all doses, which may be either recommended or compulsory, depending on the country of residence. A vaccine is an antigenic preparation used to produce active immunity to a disease in order to prevent or reduce the effects of infection by any natural or wild pathogen. Vaccine schedules are developed by governmental agencies or physician groups to achieve maximum effectiveness using required and recommended vaccines for a locality while minimizing the number of healthcare system interactions. Over the past 2 decades, the recommended vaccination schedule has grown rapidly and become more complicated as many new vaccines have been developed. Many vaccines require multiple doses for maximum effectiveness, either to produce sufficient initial immune response or to boost response that fades over time. For example, tetanus vaccine boosters are often recommended every 10 years. Some vaccines are recommended only in certain areas, countries, subnational areas, or at-risk populations, where a disease is common. For instance, yellow fever vaccination is on the routine vaccine schedule in French Guiana, is recommended in certain regions of Brazil, but in the US is only given to travelers heading to countries with a history of the disease. For newborns, breast milk can help protect against many diseases. It contains antibodies passed from the mother. However, this immunity wears off within a year, and many children aren't breastfed to begin with. In both cases, vaccines can help to protect babies and small children from disease. They can also help prevent the spread of disease to older children and adults. Vaccines imitate infection of a certain disease in the body. This prompts the immune system to develop weapons called antibodies. These antibodies fight the disease that the vaccine is meant to prevent. With them in place, your body can defeat any future infection with the disease. Vaccines are available for some of the most deadly childhood diseases, such as measles, polio, diphtheria, tetanus, and pertussis, pneumonia due to Haemophilus influenza type B, and Streptococcus pneumonia, and diarrhea due to rotavirus. Vaccines can protect children from illnesses and death. The recommended vaccination timeline is shown on the next slide. As you can see, the first 6 months is the most important period when a child gets most part of the vaccinations. In developing countries, vaccine recommendations also take into account the level of healthcare access, the cost of vaccines, and issues with vaccine availability and storage. Sample vaccination schedules discussed by the World Health Organization show a developed country using a schedule which extends over the first 5 years of a child's life and uses vaccines which cost over $700, including administration costs, while a developing country uses a schedule providing vaccines in the first 9 months of life and costing only $25. This difference is due to the lower cost of health care, the lower cost of many vaccines provided to developed nations, and that more expensive vaccines, often for less common diseases, are not utilized. The World Health Organization monitors vaccination schedules across the world, noting that the vaccines are included in each country's program, the coverage rates achieved, and the various auditing measures. The table below shows the types of vaccines given the example countries. The World Health Organization publishes on its website current vaccination schedule for all World Health Organization member states. Additional vaccines are given to individuals that are much more likely to come into contact with certain diseases due to their occupation or travel to regions where the disease is present, including members of the military, or only after potentially infectious exposure. Examples include rabies vaccine, anthrax vaccine, cholera vaccine, and smallpox vaccine. A contraindication makes a particular treatment or procedure, such as vaccination with a particular vaccine, unadvisable. Contraindications can be permanent, such as known allergies to a vaccine component, or temporary, such as acute febrile illness. Contraindication to vaccination is a rare condition in a recipient that increases the risk for serious adverse reactions. Ignoring contraindications can lead to avoidable vaccine reactions. Most contraindications are temporary, and the vaccination can be administered later. The only contraindication applicable to all vaccines is a history of a severe allergic reaction after a prior dose of a vaccine or to a vaccine constituent. Precautions are not contraindications, but are events or conditions to be considered in determining if the benefits of the vaccine outweigh the risks. Precautions stated in product labeling can sometimes be inappropriately used as absolute contraindications, resulting in missed opportunities to vaccinate. The Centers for Disease Control and Prevention has compiled a list of vaccines and their possible side effects. Allegations of vaccine injuries in recent decades have appeared in litigation in the US. Some families have won substantial awards from sympathetic juries, even though most public health officials have said that the claims of injuries were unfounded. In response, several vaccine makers stopped production, which the US government believed could be a threat to public health, so laws were passed to shield manufacturers from liabilities stemming from vaccine injury claims. The safety and side effects of multiple vaccines have been tested in order to uphold the viability of vaccines as a barrier against disease. The influenza vaccine was tested in controlled trials and proven to have negligible side effects equal to that of a placebo. Some concerns from families might have arisen from social beliefs and norms that caused them to mistrust or refuse vaccination, contributing to this discrepancy in side effects that were unfounded. Any licensed vaccine is rigorously tested across the multiple phases of trials before it is approved for use, and regularly reassessed once it is on the market. Scientists are also constantly monitoring information from several sources for any sign that a vaccine may cause an adverse effect. Most vaccine reactions are usually minor and temporary, such as a sore arm or mild fever. In the rare event of a serious side effect is reported and it is immediately investigated. It is far more likely to be seriously injured by a vaccine-preventable disease than by a vaccine. For example, in the case of polio, the disease can cause paralysis. Measles can cause encephalitis and blindness, and some vaccine-preventable diseases can even result in death. While any serious injury or death caused by vaccines is one too many, the benefits of vaccination greatly outweigh the risks, and many more illnesses and deaths would occur without vaccines. Thank you for your attention.